Welcome to the Intellectual Medicine Podcast with Dr. Stephen Petteruti, where we explore cutting-edge approaches to anti-aging, weight loss, and hormone optimization. Dr. Petteruti shares expert insights to help you live longer, healthier, and more vibrant lives. Tune in for actionable tips and the latest in personalized medicine.
Everybody wants energy. And that's one of the most common things people come to see me for is a concern about their vitality. Vitality means energy. Energy is the force of life. It's the get up and go. It is the bounce in your step. It is the thing that we had in abundance in our youth. We can remember those days. Flying around full speed all the time, barely needing to sleep, always full of energy. If the energy is declining, the question is, why? Is it normal? Should energy just fade because we're getting older? And if so, what can we do about it? Well, we're going to review that. We're going to talk about NAD, nicotinamide adenine dinucleotide, which is absolutely central, critical part of your energy production. Without it, you're like a car without gas. You can't go. And with it, you have an ability to maintain vital energy throughout the span of your life. Now, there are lots of other components of energy, and we'll touch upon them. But without mitochondria working properly, you will be depleted. Now, mitochondria, I'm taking you back, guys, to Biology 101. Stay with me. Those are the little tiny organelles inside the cell. They're inherited 100% from your mother. That's right. Nothing comes from dad in the mitochondrial world, so all that energy flows maternally. These mitochondria are unique. They don't really divide like other bacteria or organelles. They merge together and they survive for weeks at a time inside the cell. When you're young, and by young, let's say below age 30, certainly below age 40, but below 30, you have lots of them. And they are highly fueled with NAD. When we're young, we make nicotinamide adenine dinucleotide in abundance. We fuel our cells with it. At about age 20 to 30, it starts to decline, and that decline becomes more rapid at age 40. In essence, we're depriving mitochondria of the very fuel that it needs to thrive. And without the mitochondria being fueled up, the cells go into a decline. When the cells go into decline, then the tissues go into decline. Now, think about where the energy is most needed. Your heart, your muscles, and your brain. So that loss of vigor, that fogginess, that low energy state oftentimes emanates from the brain and frequently can be a consequence of low NAD. I know. You're busy. You're working hard. You've got kids to take care of, maybe elderly parents to worry about. Maybe there are stressors surrounding you. Those are real things. But how do you know that the amount of energy you have is as good as it gets? You don't, unless you have filled in all the blanks. Now, NAD, the cool thing about it, one of the many cool things about it, it's not a drug. This is a natural substance that your body makes that is a cornerstone of cellular health. Now, without enough of it, the cells degrade. In particular, nerves can degrade. It's a process called Wallerian degeneration, and it is a foundational component of neurodegenerative diseases, including Parkinson's, Alzheimer's, even MS is felt to have a component of this Wallerian degeneration as one of its mechanisms. That's right, recovering from a bit of a chest cold, which, by the way, is another trigger for depletion of NAD. When we get old, the levels decline. And when you're sick, your body burns up a ton of energy. The immune system burns up a ton. You can go into an NAD deficit. Now, you all have heard of post-COVID syndrome. Well, it's the same phenomenon, we believe, as chronic Lyme, Epstein-Barr virus, post-infectious fatigue syndrome, chronic fatigue syndrome, many different names with a common denominator. NAD gets drained out of the system, and the body has trouble priming the pump, getting back to its base. For younger folks that get this draining effect, it can lead to years of declining energy. Repleting that NAD can sometimes prime the pump and get you back to 100%. Now, as we age, repleting it is an ongoing concern because we're not going to make more. It's going to go down. And as it goes down, those cells degrade. They no longer have the same energy. The mitochondria are not healthy. Now, degraded mitochondria are a vulnerable basis upon which cancer cells can form. So this is bad news, right? But the good news part of it is we can replace NAD. It's not something that is that mysterious. NAD, the only problem with NAD is that it doesn't absorb well from the stomach. So replacing it becomes a matter of self-administered injections. These are painless, subcutaneous. Typically, we recommend them twice a week. Well, if you need energy every day, why do you only need NAD twice a week? And the answer is that those mitochondria, they live for weeks at a time. And periodically replenishing them is sufficient to allow them to carry forward with full vitality. This is a real breakthrough, foundational component of anti-aging. It is one of the base things that are nearly universal recommendation. By age 50, NAD becomes a vital component of anti-aging therapy. In animal experiments, it was David Sinclair who did a lot of the work around NAD, identifying that in lab animals, when they were given NAD, they behaved more youthfully. They got more energetic. Their coats got better. They became vital again. He's developed, and there is on the market, precursors. So there are substances you could take that your body uses to make NAD. And they've been shown to have some value. They've been shown to actually increase the amount of NAD in your system. At least in studies, they have that effect. The only variable is whether or not they're absorbed, how much is absorbed, and whether or not you're better off bypassing the stomach entirely. Now, for some of you, bypassing the stomach makes a lot of sense because the stomach's not working so good. You're the person with bloating. You're the person on proton pump inhibitors like omeprazole. That means the stomach is not at 100%. So more than anything, recommend bypassing that, going directly to the injectable form. It can take 4 up to 6 weeks to start to feel an updraft from the NAD. So you got to be patient. Those nerves, those mitochondria, they're going to take a little time to regenerate. Now, the sooner you get on this bandwagon, the better off it is for your anti-aging perspective. It's always better to prevent than to try to reverse. If somebody's in the throes of advanced dementia, starting NAD is unlikely to pull them out of it. However, if you're in the early phases or you're feeling great in the moment, remember these Wallerian degenerative conditions happen over decades. The beginning stages of it are asymptomatic. You can't tell when those nerves are degrading. How do you know? Number one, look at your driver's license. Look at your birth date. Hey, if you're past 50, you're depleted with NAD compared to your youthful self. And that's the point of comparison. A lot of my patients will come and say, you know, doc, compared to people my age, I'm doing pretty well. Now that's a good thing, but it's not the top of the mark. What matters is not how you compare to other people your age. After all, we don't want to be a typical fill in the blank. I'll use myself as an example. I don't want to be a typical 65-year-old. I don't want the hormones of a 65-year-old man. I don't want the NAD of a 65-year-old man. I want a more youthful profile in my biomarkers, a more youthful profile in my mitochondrial vitality, because all of that is going to translate into a better opportunity to maintain a high energy lifestyle. Now, high energy lifestyle, I'm not talking about hang gliding necessarily, parachuting, daredevil stuff. I'm just talking about the get up and go. Having that extra bounce in your step at the end of the day so you can enjoy time time with your children, time with your friends, time with your wife. You get home at the end of the day and you're washed out, drained. That's not normal. That is modifiable. Do not accept that state of being. The evidence is abundant. The research is in. And the biological opportunity to enhance cellular health is here. I recommend you get connected with a primary care anti-aging specialist. They're out there. They're not a ton of us, but it's a growing field, a growing niche. How do you know when you've found a good anti-aging specialist? Well, number one, you came to see me, then you have no worry about that. But I understand you could be listening to this from a far distance. Here are things to look for. You want somebody or some person with primary care training. You want them to be a generalist, not a limited practitioner. Limited practitioners, sometimes called specialists, are great in their niche. But we're talking about a broad, whole person approach. Then, if they take insurance, they're going to be very limited. It's not that it's wrong to take insurance. It's just it comes with constraints on practice, limits regarding what can be said, what can be done, limits regarding the amount of time one can spend. So primary care doctor who does not take insurance and has some degree of established credibility in functional or anti-aging medicine. Then you keep listening to my podcast. And then you go to the doctor and you say, well, Dr. Petteruti was talking on his podcast about NAD. Tell me what you think about it. And if they look at you quizzically, then one of two things. Either you need a new doctor, or that doctor will take it upon themselves to educate themselves, fill in the blanks, and deliver the treatment that can help you. We have something called Intellectual Medicine University, IMU. University is open to everybody. You could sign up for a course if you wanted to. It is actually designed for clinicians. And there are courses in NAD. It's not that hard to understand the biology behind it, to understand the science behind it. And the courses are available for you. Why not? You don't have to be a doctor. You have to be an intelligent person with curiosity, with a desire to age differently, or at least a desire to know more about the whole concept. Curiosity drives investigation, and that gives you the opportunity to make choices about how you want to function. How do you want to age? It is now an option. And I don't know too many of you that'll say, yeah, I'm good with the low energy state. That's cool. I'll go home and I'll nap every day and just kind of sit there. Not wrong to do that. It is absolutely a choice. But it is a choice, folks. It's not inevitable. And you're not destined to that outcome just because of your age. Now, there are drugs that can drain you of energy. There are illnesses that could suck out your NAD. There are other causes of fatigue. We haven't touched upon sleep or hormones or thyroid. These are all factors, but these are variable factors. A universal component is this story of the NAD. Why? Because everybody gets depleted over time. Levels go down. Energy goes down. You don't have to accept that. It will help keep your brain fresh. It will help make your cells more resilient to disease, and by extension, has the possibility of making the cells more resilient to cancer. It bothers me that dementia, heart disease, and cancer are still rampant in our country, in the world, and that we're not really upset by it. It's as if we've come to just accept it as the way things are. Now, I understand that we can't change the world from the top up, top down, but we can change the world from our personal perspective, from the inside out. You can decide how you want your body to be handled, how you want your body to be invigorated. Yes, it's a polluted world, but you can make yourself more resilient. Not necessarily bulletproof, that's a little bit of an exaggeration, but resilient. Those carcinogens floating out there, They can bounce off of a well-endowed immune system. And that well-endowed immune system is going to run in part on NAD, nicotinamide adenine dinucleotide. Twice a week injection. At Intellectual Medicine, we have this available. It requires a brief visit. It requires medical clearance. Although it's extraordinarily safe, it is a prescription agent. No, you can't just buy this on the internet. Well, I suppose you could. I mean, you can buy anything on the internet. But it's flying blind, folks. You owe it to yourselves to make sure you get good guidance in this regard. Are supplements worth taking? Are the precursors worth taking? They can be. Nicotinamide riboside is a precursor to NAD. Taken 500 milligrams a day has been shown to have some value and is a sensible step. Using that instead of the injection, totally reasonable. Although I favor the injection personally for my patients, and it's what I choose to use. It's not for everybody, and the oral supplement, the precursor, is a definite option. In summary, I think you ought to do something. You ought to do something to preserve those mitochondria. You got to do something to keep the nerves healthy, the brain healthy. You want to get in front of this wave. You do not want to wait for the moment of decay, because when it comes, it builds up momentum. It's like an avalanche. And if that avalanche gets going too hard, too fast, it's hard to stop. Live to be 100? Yeah, I'm down for that. Live to be 100 while my brain and my nervous system decays? No thanks. What can we do? NAD is part of that equation. Protecting your nerves and protecting your brain is one of the most important priorities when it comes to anti-aging and life extension. And those two areas are the hardest to do because those cells, the neurons and the nerve cells, they don't reproduce very quickly. And when they get damaged, they stay that way for decades. So get your NAD down. You can check out our website at Intellectual Medicine. Shoot, you can even go to the university and take the course in NAD. You'll become an expert on it. Educate your doctor about it. Maybe he'll prescribe it for you. Anyhow, guys, thanks for spending a little time with me. I hope you're enjoying life, staying vital, asking yourself the question every day, don't I love being alive? Isn't it a great gift? And don't you want to pour energy into it so you can pour energy out of you and toward all the people you love? Until next time, I'm Dr. Petteruti at Intellectual Medicine. We'll talk to you then.